Hello, and good afternoon to Sharon Solutions for Home Healthcare. I wanted to touch base with my nurse friends today and also other clinicians, as well as family and friends, and just talk about a couple things that we're hearing about in the news, on social media. I'm a registered nurse and have been for several years. I have been teaching infection control to patients and their families and clinicians for years in the United States and outside of the United States. I have been a proponent of public health and prevention, infection control, and prevention for years. And so I wanted to address a couple things today based on what I am reading when I'm doing research. So today we're going to talk about the definition of protective personal equipment, PPE. We're also going to look at the Journal of American Medicine Association, an article especially that was written in April of this past spring, 2020. And I'm just going to reference it as well as quote it. So maybe with the information that we are given by our medical organizations, we can come up with a good solution. So this is all about solutions, not just home care solutions, but infection control and the solutions around specifically today, the wearing of masks and hand hygiene. So as we get started, I'm going to quote the Health and Safety Executive.gov website that says personal protective equipment by definition is designed to protect the wearer from injury and infection. That's a little bit different than what we're hearing now. We are preventing others from getting infectious diseases. But by definition, the Health and Safety Executive.gov is saying that is designed, PPE is designed to protect the wearer from injury and infection. So as we think about that and think about common sense infection control, I want to look at the Journal of American Medicine, an article that was published March 4th, 2020, and quote specifically a couple items. Face mask should be used only by individuals who have symptoms of respiratory infection, such as coughing, sneezing, or in some cases, fever. Face masks should also be worn by healthcare workers, by individuals who are taken care of or are in close contact with people who have respiratory infections, or otherwise as directed by a doctor. Face masks should not be worn by healthy individuals to protect themselves from acquiring respiratory infection because there's no evidence to suggest that face masks worn by healthy individuals are effective in preventing people from becoming ill. So that's different than what we are hearing. We have places that are requiring us to wear masks, even when social distancing is able to be maintained. But here, the Journal of American Medicine Association tells us that it is not to be worn by healthy people, healthy children. But if we are required, and we are in many places, then how do we wear a mask? How do we don a mask properly? And how do we doff it? How do we take it off without contaminating our hands? So let's go back to the American Medical Journal of Medicine, their journal article that was written in March of 2020. And it says this: If wearing a face mask is indicated, it is important to wash your hands with soap and water for at least 20 seconds prior to putting on the face mask. An alcohol-based sanitizer that contains at least 60% alcohol can also be used if soap and water are unavailable. After cleaning your hands, place the face mask over your nose and mouth. Make sure there are no gaps between the face mask and your face, ensuring a tight seal. Try to avoid touching a face mask when wearing it. If you do touch the face mask, what are you supposed to do? Wash your hands or use a hand sanitizer again. When you are done using the face mask, remove it without touching the front of the face mask and discard it into a closed bin. Wash your hands again after discarding the face mask. Okay, so that goes totally against the current fashion trend of the day, where we are hanging our face mask on our rearview mirror in our car, or wadding it up and putting it in our pocket, or wadding it up and sticking it in our purse, or better yet, just hanging it on our ear. And when we do that, every time we touch it, every time we touch our face when we're wearing it to adjust it, guess what happens? We have germs on our fingers. Common sense, right? Evidently, we've lost our common sense in the midst of all this craziness. But if we do not don and doff a face covering or face mask appropriately, we may be increasing the spread of a virus or other infectious agents by the transmission of the germs on our hands from touching the face mask that we are wearing over and over and over again. If I sound like I'm a little perturbed, I am. And it is because we have lost common sense regarding infection control. And I've always been about infection control in our patient's home, in our family home, at our churches, in the stores. But somewhere along the line this spring, we have lost any common sense about infection control that we should have been having all along. One more thing before we go today, I wanted to talk about hand hygiene, because this is the number one mode of transmission of infectious agents. It's the number one way that me and you can truly provide infection control. This again is from the Journal of the American Medical Association from March of 2020 this year, which says, hand hygiene is one of the most important ways to prevent acquiring and spreading respiratory infections. Wash your hands often. Try not to touch your nose, your eyes, your mouth prior to washing your hands. Avoid close contact with others who are sick. Clean household surfaces and objects with wipes or cleaning spray when available. If you become ill, stay home to avoid making other people sick. Come on, guys. This is common sense. Let's get over the wearing of masks and touching our hands over and over and over again, and touching everything else around us without the appropriate hand hygiene. Thank you for joining me today. I hope that you guys stay well and that you take care of you and your families and those around you. And we'll see you next time. Bye-bye.